Okay, and this is a way to categorize priority. Just an example. And I think it's pretty obvious, you're going to life-threatening things are gonna really could kill my patient quickly, right? So those have to be a priority. Respiratory distress, chest pain, anaphylaxis, lethal cardiac dysrhythmias, shock. Those are all things that if I don't do something right away, it's going to be very dangerous to my patient. There's urgent events, right? Acute pain, mental status changes, pain relief can be urgent. And then our lower priority, but still important, physical mobility, or my patients have a knowledge deficit. They don't understand the instructions to go home. Those would be a priority, but they would not take precedence over some of the life-threatening or urgent priorities. 57-year-old who is admitted to the hospital with a diagnosis of hyperglycemic, hyperosmotic, non-ketotic syndrome. We're going to go over that tomorrow, by the way. So we know it's a diabetic emergency. His vital signs, 102.1, 127 heart rate, 30 respiratory rate, blood pressure 112/68, blood glucose is 900. Place the following nursing actions in order of priority. So that ranking of what is the most emergent. So what you look at these questions, you want to think, okay, what do I know about somebody that's in an evolving diabetic crisis? And which thing am I going to want to put first? You have your insulin drip, that's appropriate. Your antipyretic, yes, I want to get blood pressure or temperature down. IV fluids, what do we know about these patients? They diurese, right? They come in profoundly dehydrated. Assess lung sounds. We said after you will want to assess, your interventions. Check serum potassium levels. So all of those are important, right? But I think I saw my answer come in. Yes, 3, 1, 5. Yep. So the most important is getting the fluids going, because we know that the insulin drip is very important also to get the sugar down, but you need that circulating volume to even make the insulin effective. And you really have to get that fluid going to rehydrate that. So the first two we said, checking potassium levels. We know there's a danger of those potassium levels going up in these patients. And that can cause cardiac problems, right? Cardiac dysrhythmias. So that's important. Then getting that fever down and assessing lung sounds. We're giving fluids. We're trying to prevent the profound and correct the profound dehydration. And you want to make sure that they're handling all those fluids.